morning. I've talked a lot about TMJ in the past, so I thought this morning I would just talk about one technical issue, and that is the electric handpiece. And they've been around for a while, but they've gotten better and better, and I thought you might want to see what's going on with them. We have a new and improved design, and the latest handpiece, this electric drill, that's what we use, the dental drill, has many attributes. It's quieter, less likely to bog down, and it cuts smoother preparations. When you do a crown preparation, it comes out nicer, smoother, cleaner. It's well made, and the USC School of Dentistry has adopted it for use in the student and graduate clinics. So there it is. And this has inside of here is an electric motor that makes it spin. It can go up to 200,000 RPM. Wow. And the speed is controllable with the dials. It adapts to the task at hand, and it has greater control, especially when you cut through enamel or you're doing a crown preparation. It's a lot smoother, easier, you have better control. This is the old windmill. See, that's the drill that you hear. Can you hear it? Can you hear it? Yeah. Okay, this is electric. A little different. Okay. As a dentist of 45 years, the transition to the new handpiece, I've been told it's difficult for some practitioners, but I found it very easy because it does a very smooth job. And when I do difficult procedures where I have to take out hard materials like old composite, it's much easier. So that's the pep talk for what's new in dentistry. I have to go back and set up the new one.
All right, Gil, so you pumped us all up. We're all pumped up. Physically, we're not, but emotionally, we are.
Okay, you all don't like blood and gore, so I picked a topic in dentistry that is interesting, new to some dentists. Some dentists still don't understand it, even though the technology and the proof has been around for about 3 decades. I still encounter dentists who argue about the existence of what we call an abfraction. Okay. An abfraction is a defect at the cemento enamel junction. That just means where the enamel ends on your tooth and touches the root. That junction develops defects if you have malocclusion, if you have a crooked bite, or if you have a stress that is not normal, abnormal, or not good. Okay, the stress can be in any direction, but occurs most on the buccal of the teeth, on the cheek side. Sometimes the defect is deepened by excessive toothbrushing, hence the misunderstanding. So when occlusal stresses occur, and you bite and something's hitting wrong, you can actually bend the tooth. And this was discovered about 30 years ago by German dentists that used the electron microscope. Previous to the electron microscope, we could only see 1,000 power. And I used to be a hematology technician, and I used to look at blood at 1,000 power, and I can see a red blood cell. That's 1,000 power. The electron microscope is 100,000 power. And they found that if you hit the tooth wrong, if you stress it wrong, you literally can bend it and a microscopic piece of the tooth comes out. And that's what an abfraction is. So this is a really good example of an abfraction, because you have a smaller piece missing here, a large piece missing here, and right in the middle, there's still tooth there. Well, that's very strange, you know, and so it can't be from brushing the wrong way, because if you brush the wrong way, you would just have one big defect here. So it's very significant. And when you look at the occlusal surface, the chewing surface, and you have them bite on articulating paper, you can see where it's hitting too hard. And you see, yeah, this patient has crooked teeth, so it's the formula for having a crooked bite and teeth hitting wrong. And then when you push on the jaw, and many of you that are my patients remember when I have you bite and check the bite, I'll push on your jaw when you're moving. That replicates what you do when you clench and grind, and you get a different marking, a much stronger marking, because that's actually what you're doing when you clench and grind at night or during the day. So this is what it looks like before the induced side shift, before we push hard, and you can see the areas that are hitting hard. But then when you push, everything's bigger, everything's harder. So this is how I know where the teeth are hitting improperly and how I can adjust it. See, so you see the shiny surfaces. You see the shiny surfaces. And the lower tooth that's hitting the upper has a big one, the lower tooth has a smaller one. But you see, it's a little notch just on one side, not here. And that's how you know that it's an abfraction, not toothbrush abrasion. So this is for dentists. I prepared this for dentists. It's easy to spot if you know what to look for. And you must know how to spot the occlusal interferences. And then you must learn how to correct the interferences that cause the defects. If you don't take care of that, then the defects will come back even if you restore. So those are my words of wisdom for today. Maybe a little technical, but no blood. Thank you for your attention. Any questions?
Yes, Kathleen is with
Do you have time for a question? So what do you do to fix that?
Well, you have to get rid of those interferences. I reshape the teeth so when they hit, they don't bend. That's the basic.
So you shave off a part of the tooth above it so that it
But
doesn't hit?
you have to shape it very precisely so that when they function, it's not in the way.
Interesting. Okay.
bite correction.
Bite correction, yeah, you can say. Any more questions? Thank you for your attention.